Good morning, everyone, and welcome to the KT Canada National Seminar Series. I'm Kim Miller, and I'm the Senior Leader of Clinical Education and Special Projects at Sunny Hill Health Centre for Children, and I'm your moderator here at the site this morning. Once this presentation is concluded, you're going to have an opportunity to ask some questions, and we ask you to ask those questions on the chat box. During the session, you can still contact us using the chat box. For now, we're going to have everyone muted so we can hear the presentation. It gives me great pleasure to introduce Alison Hoens. Alison is the Knowledge Translation Specialist for the Methods Cluster at the BC Support Unit. She has been a mentor and a trailblazer for many of us in this area for some time. She started as a knowledge broker for the Department of Physical Therapy at the University of British Columbia for about 7 years ago, and in her capacity as knowledge broker, she has facilitated partnerships in over 50 projects between more than 400 researchers, clinicians, decision makers, and patients in clinically relevant research and in the development of resources that have been accessed provincially, nationally, and internationally to support evidence-informed healthcare practice. Alison's presentation today is Knowledge Brokers, Are They the Answer to Knowledge Translation Challenges in Healthcare? Thank you very much, Alison.
Thank you. Thank you to KT Canada for this opportunity, to Arthritis Research Canada for hosting us, and for the technical assistance from Jenny Leese, who enabled all the wizardry behind the curtain here, and to Dr. Kim Miller for the kind introduction. But mostly, thank you to all of you who are joining us in real time, or to those of you who are joining us asynchronously to view the recording. I'll endeavor not to disappoint. The title for today is Knowledge Brokers, Are They the Answer to Knowledge Translation Changes in Healthcare? I'm just getting there. Okay, our learning objectives for today are around being aware of key messages from the literature and from personal experience with respect to the knowledge broker role, particularly in the setting of healthcare, the evidence regarding the effect or effectiveness of knowledge brokers in healthcare, and then some key issues identified, again, both from the literature and from personal experience related to training, support, and evaluation of effectiveness of knowledge brokers. And finally, that this information then can assist you in reflecting upon if and how knowledge brokers could be incorporated within your own organization. So, why? Well, the most concise and basic rationale for the need of knowledge brokers is the often cited gap between research and practice. However, somewhat less frequently cited is that this is a two-way arrow, that there's a bidirectional relationship for this gap, that there's an opportunity to improve not only the incorporation of more research findings in practice, but to incorporate more practice-relevant information in research. In preparation for this webinar, during a review of the literature, I was intrigued by a unique description of this as a semantic distance. Referring to the fact, or highlighting the fact, that this gap reflects, at least to a degree, a difference in meaning. Not just different needs between researchers and practitioners and policymakers, but also a difference in meaning. So, if we accept that a gap exists, and there's certainly plenty of evidence to substantiate that, that the next logical step is to look at what is the effectiveness of other strategies that are used to help translate research into practice and vice versa. Sharon Strauss's work and many others have shown that use of existing strategies such as didactic sessions, educational resources, clinical pathways, and many others that you see cited there, they typically these typically report change in clinical practice of only about 10%, and this is not very encouraging. Therefore, this less than inspiring evidence of effectiveness for these other strategies to facilitate knowledge-practice interaction has contributed to the increasing curiosity of the potential for knowledge brokers as a KT strategy to facilitate change in practice and policy. So the focus of this presentation then, and the question that I'm tasked with answering, is using evidence from both the literature and personal experience as KB, are they the answer to knowledge translation challenges in healthcare? This was a paper that was recently published, as you can see, in January of this year, in a journal on seismology. And the question asked by this piece of work was, do large magnitude global earthquakes occur on preferred days of the calendar year or lunar cycle? That was their question. And as you can see in the abstract, it is a very succinct no. So, a spoiler alert for the rest of this presentation. If the question is, are knowledge brokers the answer, I have to say a qualified no, but I hope to be able to provide you now with some details of where they can be effective. So the literature is inconclusive in terms of a definitive yes, but very encouraging in terms of a qualified yes. So the outline for today then is to focus on 4 components. First of all, to provide some definitions of what we're talking about, then to review the literature in terms of roles and activities, the literature in terms of evidence, and then from that, identify the key issues which murky the water a little bit in the role of knowledge brokers in translating information. But first, to establish some context for me regarding who is participating today, I would ask for your permission to let me indulge in asking you 2 questions. So the first question is, would you identify yourself as a knowledge broker? If you select option C to this question, I invite you to provide a little bit of detail in the chat box as to why you have answered C. And Jenny, maybe you can let me know what the responses are, because I can't see them.
Just waiting to see the responses now come through in the chat box.
And how do we look here in the responses?
Got about 5 yes and 1 no.
5 yes and 1 no, and then I also notice in the chats that are coming up is some people are answering yes, but not called a knowledge broker, which is wonderful to hear because that fits nicely with what I will be sharing. So then the second question here is, would you describe at least a portion of what you do as knowledge brokering, even though you might not have a title, knowledge broker? And I think I'm seeing a resounding yes, 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 yes from everybody. Thank you. Okay, the next section of this presentation, particularly appropriate. So let's go on then to how we define a knowledge broker. If we look at the definitions in the literature, you will see that it's variable. There's no single accepted definition of a knowledge broker. However, there are some common elements that we see regardless of who and when they defined knowledge brokering. And these common elements are that they're human. Well, thankfully, that's a good thing, neither machine nor animal. Second of all, that there's the element of knowledge, which makes inherent sense. And third, that it involves movement of that knowledge amongst stakeholders. And finally, that there is a shared purpose in that knowledge movement. The knowledge broker is noted as the person between, that intermediary, that bridge, that boundary spanner between silos and between worlds. And it's interesting because Caswell and Lyle in 2008, when they did a review of knowledge brokering, noted that there was a long history of knowledge brokers in industry, in social sciences, in engineering, and in IT. But it's only been relatively recently, within about the last 10 years, that there's been an emphasis on it in healthcare. Long et al., in their systematic review in 2013, said that the role of the knowledge broker is the person who reaches across structural holes. So as you can see, the key messages here in the definition of knowledge broker: human, reaching across, knowledge, movement, shared purpose. Other things that we can see in the definition, again, definitions from Trish Grenhaw and from Loomis and from Dagnaw in 2015, so from 2004 to 2015, regardless of the time period of the definition, is the relationship piece. The piece about a social element to the knowledge broker, that knowledge depends on its circulation on interpersonal networks, that human interaction is required, and interpersonal contact is essential. So those are common things that we see in the literature. If you want to go to images, though, it's quite interesting. If you Google broker, you'll see the images on the left, which are somewhat less attractive in terms of the nature of a knowledge broker, reflecting perhaps some questionable personal gain in being a knowledge broker. I can assure you that there isn't that financial gain associated with it. However, if you look for images more about the role as a facilitator, you'll see images such as those on the right that indicate more an intermediary, a facilitator, an orchestrator, a person who is conducting music, making beautiful music together. So it depends if you use the term, unfortunately, broker as a part of that image. So I prefer not to use those images. Let's now define knowledge brokering. Well, knowledge brokering is a KT strategy. It's a process, it's a method. It's not the person, it's the activity. And to a large degree, in what you've all answered, every single person in response to question number 2, is that many of us, even though we are not officially given a title knowledge broker, are knowledge brokering to various degrees. So then, who is a knowledge broker? As just stated, the title can be quite variable, and other common titles that you can see in the literature and in job descriptions that involve similar roles are a knowledge specialist or consultant, knowledge exchange specialist, knowledge translation specialist, knowledge mobilization specialist, and a plethora of others. And as we've stated, some people function as knowledge brokers without possessing this or a similar title. I really like this model from the K-STAR group in 2012, who nicely depicted in this graphic different titles or roles related to functions. So if we look at the upper part of this image, you'll see that there are three functions: informational, relational, and systems. Information refers to collecting, codifying, and storing the information. Relational refers to identifying and facilitating relationships and co-production of the information. And systems refers to working across an entire system to negotiate change in process or policy. What you can see here is that there's overlap in roles. So if we start from the far left, an information intermediary is the person who functions virtually primarily in that informational function: collecting, codifying, storing. You might think of that person like a librarian. So in that way, they are functioning as knowledge brokers. A knowledge translator then is helping people to make sense and apply that information, but still needs to be able to collect, codify, and store them. The unique aspect then of the knowledge broker, in addition to being an information intermediary, a translator of that information, is also being able to foster the relationships that enable the co-production of knowledge. And of course, the golden goose at the end is the innovation broker, who can influence the change, be involved in changing the context, in negotiating change in policy or practice. So I invite your comments. Perhaps there will be an opportunity at the end to discuss your perceptions of that model, but it certainly resonates with me as a person who's living in these spheres. So let's talk a little bit more now, explore what the roles and activities are of the knowledge broker. So if we look again, Meyer's work in 2010 defined what a knowledge broker does as more than moving knowledge, but actually transforming that knowledge. Brokered knowledge is made more robust, accountable, more usable. It's knowledge that serves locally at a given time. It's being deassembled and reassembled. And that occurs within the realm of creating those new relationships. It's not done in isolation. It is done within the context. Now, one of the first individuals to really look at the activities of a knowledge broker was Dr. Vicki Ward, and in 2010 and subsequently thereafter, she enriched this model. She created what I would like to call a process model for knowledge brokering that acknowledges that at different phases in brokering knowledge, there are different emphases. So at the beginning, there's an emphasis on really identifying and understanding the problem, and understanding the context, identifying the facilitators, the barriers within that context, ascertaining the knowledge relevant to that context, and then selecting and conducting the intervention, the strategy that is most applicable to implementing that knowledge. And then, over time, an increasing focus on in supporting and monitoring the use of that knowledge. So this model, as I said, I like to think of it like a process model. More popular after that time were role models for knowledge brokering. And commonly we see three different roles of a knowledge broker: knowledge management, knowledge linkage and exchange, and capacity building. And Birnbaum produced a systematic review and a thematic analysis in 2015, acknowledging that the knowledge broker likely operates as an amalgam of these roles, depending upon the goals of the specific KT initiative. So there might be more emphasis on one or another, or a combination of these roles, depending upon what the goals are of that specific KT initiative. So generally accepted in the literature, we see these three roles for knowledge brokering. However, a colleague of mine, and I believe she might be listening in today, Stephanie Glegg, and I looked at those existing models and added to those two other domains. And those domains are facilitating and evaluating. What you can see on the screen here, and I believe that these slides will be made available as a PDF from KT Canada after this presentation today, we created a video abstract of this model, of the role model for knowledge brokering in healthcare settings, which builds not only on those previous existing three domains, but adds those domains of facilitation and evaluation. We also added examples of those in both our work worlds, in Stephanie's work world as well as in my work world. So I invite you to take a look at that model and to reply to the video abstract so that we can create a conversation, enrich the conversation about those models. One of the really interesting things about, or ramifications of sharing new models and sharing new ideas is creating a conversation, catalyzing that conversation. And recently, Trish Roche, who works with Knowledge Nudge at the Center of Healthcare Innovation in Manitoba, did an interesting blog. And in that blog, what she did was take this is a busy slide, but as you can see, it's an image. If you look at the first three columns, information management, linkage and exchange, and capacity building, so the existing three, the very common roles for knowledge brokers. She then added two columns to the right, highlighted in green here, facilitation and evaluation, from Stephanie's and my model, and identified specific tasks within each of those domains, comparing and building the Birnbaum et al. Systematic review and uniting our model to it. It was really intriguing to see that work, and I am pleased that living in the world of the Twitterverse, that we were able to share this information on Twitter. The final thing that I would like to share with you all about roles, about knowledge brokering, is that they're not static. There's evidence from Hertebee's work in 2016 that the roles can change over time. What Hertebee's et al. Looked at was communities of practice and knowledge brokers facilitating virtual communities of practice. They had therapists who belonged to a virtual community of practice, and they analyzed 95 posts on that community of practice and identified three roles: the role as a context architect, a role as a knowledge-sharing promoter and a linkage creator. And the unique contribution, in my view, of this piece of work was to show that at different periods of time, based on the context, the relative contribution of each role will change. It's not static. Okay, so hopefully then we're on the same page as far as defining what a knowledge broker is, and we have some models, process models, and role models with specific activities underlying each that looks at what a knowledge broker does. So now let's explore a little bit about what exists in the evidence in the literature in regards to the effect/effectiveness of knowledge brokering. I want to focus just on healthcare, but one of the slides that I will be sharing is out of the realm of healthcare. But there has been a recent deluge of literature specific to knowledge brokering in healthcare that reflects different disciplines, different settings, different populations, and different purposes. And I've just put these in these categories in order to see, as you can see, some of these works fit within a number of different categories. So let's start with comparative effectiveness. This was one of the first pieces of work done in Canada that I'm aware of by Dobbin's group that looked at knowledge brokering in public healthcare departments between 2004 and 2006. They looked at 3 interventions that were implemented over a 1-year period. And those interventions were access to an online registry, tailored messaging, or use of a knowledge broker. And their objective was to see which of these 3 interventions had greatest influence on adoption of research evidence in those public health departments. 141 departments were involved, 77% response rate, so that is fabulous. What they discovered was that there was no significant effect on the extent to which research was used in a recent program decision. However, there was a significant effect on the policies and the programs only for tailored, targeted messages. This was especially true if the organization valued research evidence in decision making. However, the devil is always in the details, and you need to read the methods and you need to read the discussion to be aware of the fact, not just the abstract, that the knowledge brokering approach varied. It was not consistent amongst them. There were common elements to it, both as it required adapting, disseminating the knowledge, and networking. So that was the one piece of work that looked at comparative effectiveness. There was some work done by Dagnau's group relatively recently in 2015 that also looked at the public health setting and the result of just a KB intervention, so not in comparison to other strategies, and looked at the effect of the KB intervention on the different phases of change. And you can see below the screen here that those phases are identified in knowledge, persuasion, decision, implementation, and confirmation. Their work showed that the knowledge brokering intervention facilitated change in knowledge and persuasion. There was evidence that those phases did change. It may have facilitated decisions, but it did not facilitate implementation and confirmation. I thought this was a really unique contribution rather than just saying globally, was it effective or was it ineffective, to look at which particular phases of change it was most effective. They also looked at the effectiveness of knowledge brokering in terms of system levels change. Now, this is, some of you may be familiar with this model. This is the interactive systems framework for dissemination and implementation by Wandersman. What Daigneau's group did was show that the KV intervention, there was evidence that it may have affected change at the distilling and supporting systems level, but not at the delivery system level, at applying that knowledge. So there was some consistency that the earlier phases of change and the lower levels of the system, knowledge brokering, was effective. In the more complicated levels of change in phases and systems, that evidence was not as persuasive. Now let's look at some of the literature on the effect of knowledge brokering for process for policy change. Moore et al.'s group looked at knowledge brokering on the quality of rapid review proposals. 30 reviewers who had previously undertaken reviews using Sachs's Institute of Evidence Check were blinded to 60 pre- and post-knowledge brokered proposals. So what happened here is that proposals written to elicit rapid reviews were either supported by a knowledge broker to be reframed and rewritten, or they weren't. So it was pre and post knowledge brokering to reframe and revise those proposals for rapid reviews. They looked at 6 questions on the clarity of the review's purpose, its questions, its scope, its methods and formats. And they found a significant change, that those reviews were much more useful when they had been brokered with experts, in this case, senior scientists who had experience, significant experience in knowledge brokering. And finally, in terms of, we always like to look, of course, for systematic reviews and meta-analyses, but we can only, meta-analyses are only possible, of course, when there's similar outcome measures that are used. There are no meta-analyses that I'm aware of because the metrics are not synonymous across studies. However, there are several systematic reviews, the most rigorous of which I would say is the one undertaken by Bornbaugh et al. In 2015, which I referred to earlier in that comparison to the role model that Stephanie Blagan and I had proposed for knowledge brokering. So this systematic review and thematic analysis looked at both the function and effectiveness of knowledge brokers. We've already explored their work as far as the function, but now let's concentrate on the effectiveness of knowledge brokers as facilitators. They looked at 8 databases and gray literature, close to 8,000 records, 240 full-text articles. 29 were selected, and they used a really interesting tool. If any of you have had the opportunity to look at the MetaQuad The MetaQuant is a tool that's appropriate for synthesis of a range of types of evidence: qualitative evidence, quantitative evidence, mixed methods, gray literature, and it includes a lovely blend of Prisma, Consort, Agree, the McMaster tools, etc. So if you haven't had a chance to explore this tool, I would encourage you to do so. There were 8 papers which could be examined as far as effectiveness. And specifically, did knowledge brokering change knowledge, skills, policies, or practices? 2 of the 8 met the standards of rigor. With respect to change in knowledge, 3 of them, with methodological concerns, showed positive change. 1 of them, which had no significant methodological concerns, showed positive change. In respect to change in skills, 2 of them, both with methodological concerns, showed a positive change in policy-making skills. And finally, in terms of change in practice or policy, 4 of them showed positive change. 2 of them had some limitations, 1 great and 1 good, but with high participant turnover. So there is some evidence for change in knowledge, skill, practice, or policy, but it's kind of mixed. Now, we don't just look at, there's many ways to look at effectiveness, and one of the most recent ways to assess effectiveness, particularly when we've said that one of the major roles of knowledge brokers is about facilitating those relationships, is how do we measure? How do we evaluate and measure those change in relationships? So Thematic in 2017 did a social network analysis to undertake this. Now, I share with you that this was not in the field, in the domain of healthcare. That, in fact, this was in environmental, management of environmental resources. And it was a case study undertaken in Australia over a 12-month period. And they examined the extent to which knowledge brokers develop networks between producers and users. What you can see by this graphic at 3 months and later at 12 months is that there was an increase in the extent of the networks, both in terms of density and cohesiveness. And density and cohesiveness have been shown to be crucial elements that are necessary to underpin successful knowledge exchange. So if we had to strictly, if this was a Cochrane review and we had to say, you know, what is the summary of the level of effectiveness in knowledge brokering, we'd have to state that it's inconclusive. But as I showed you in that original slide about the abstract on the effect of is there evidence to show that there are earthquakes occur on specific days of the year, it's a qualified yes or a qualified no. And I like Choose et al. Comment from 2013, where they summarized the effectiveness of knowledge brokering by saying, it seems